Hi guys, it's Miss Tanish One. Long time no see. So I've been going for 2 years. I have not made a video in 2 years, and some of you guys emailed and you guys were just very worried and wondering where I've been, and I said, I'm still around. Follow me on Instagram. I post on Instagram all the time. During that time I was not feeling well, and over the course of a few months, it went from not feeling well to feeling very, very ill. So I'm just gonna go ahead and let you guys know what has been going on with me. So I went to my primary care physician, and I have been to the doctor several times before that, complaining about my period, and I was given Motrin, and I was told that you could basically cramp any time of the month during your cycle, and it was really nothing. And I over a course of about 5 years, I was back and forth to the doctor, and nothing was really done. It was never really looked into. So this time when I went to go see my doctor, I was very proactive about my health, and I'm just like, I feel something is going on, like something inside of me is wrong. Like I feel it. I should not be in this much pain. So my doctor sent me to go get a sonogram to basically look inside my pelvic area, and I got a call back the next day. And by the way, just to let you guys know, this is my story, and I was diagnosed with stage 4 endometriosis. But I'm just going to go through what I went through to get this diagnosis, because it was very difficult for me to get a diagnosis. So anyhow, I got a call back the next day saying that they found something in my bladder that was about 2.5 centimeters big. So immediately, my doctor, he called me at work. I work as a teacher, and I work with little children. So I immediately stepped out. I'm like bawling, crying, because immediately I jumped to the conclusion that I have cancer. I was like, it's bladder cancer. Like, I know it. Like, there's been several occasions where there's been blood in my urine. I can't hold my urine for, longer than an hour. It's just like I've had these symptoms for a long time, and I just knew that I had like bladder cancer. So anyhow, I believe from that process, like from them actually finding something in my bladder, it took about 5 months to get an actual diagnosis, because they just did not know what it was. I was referred to urology. From that point, I worked with a specialist, Dr. Moore's-Rowe, and we went through a battery of tests. I'm talking about CAT scans, MRIs, all types of fancy imaging, and I was poked and like given shots and hooked up to machines, and it just was a nightmare, and no one really knew what was wrong with me. I spent about 4 to 5 months in urology, and they were ruling out things. They kind of knew that it wasn't cancer, because cancer looks like a certain way, and from all the imaging, they had no reason to believe it was cancer. So at least I was in the clear from there. So after my urologist could not figure out what it was, I was referred to gynecology, and that is where I met Dr. Maheshami. Here is Dr. Maheshami's card, and he specializes in gynecology oncology. So I'm like, the hell? Like, I thought this cancer thing was out of the picture. Like, why am I being referred to like a specialist that deals with oncology, which is cancerous? So I was just like, oh my gosh, I can't even verbalize everything that I've been through in this last year dealing with this whole situation. But from there, Dr. Maheshami, he was like a blessing. Like I'm getting emotional, because like this whole process was so much. But things started to look better when I finally was introduced to Dr. Maheshwari, and he's such a good surgeon, doctor, and you can tell that he really cares about his patients. But anyhow, Dr. Maheshwari, he knew like immediately what this thing in my bladder was, and he was the first one who mentioned endometriosis. We talked about my options. He gave me 2 options, which was surgery and Lupron. And both of those options was done for me specifically to preserve my fertility because I don't have any children yet. With Lupron, you would be giving these monthly injections, and basically Lupron puts your body in a state of a chemically induced menopause. You know, when I heard shut down reproductive system to like an early menopause, I was just like, no, I'll just, I'll go for the surgery to have it removed from my bladder. So we figured the best option for me was to go into surgery. I'm just going to go ahead and read this definition of what endometriosis actually is. And endometriosis is and I'm reading word for word, a painful disorder in which tissue that normally lines the inside of your uterus, which is the endometrium, it grows outside of your uterus, which they call an endometrial implant. Endometriosis most commonly involves your ovaries, your bowels, or the tissue lining in your pelvis. So in endometriosis, it is displaced endometrial tissue that continues to act as if it normally would, which means that it thickens and it breaks down and it bleeds with each menstrual cycle. So my endometriosis was on my bladder. So we have this tissue that's on my bladder that's not supposed to be there, and the tissue on my bladder would break down every month just like you do in your normal cycle, and it would bleed. So I would get a lot of bleeding when I wasn't on my cycle. So anyhow, because this displaced tissue has no way to exit your body, it becomes trapped. I decided with my doctor that I would opt for the surgery because I didn't want my reproductive organs shut down for 6 months because there was no guarantee that my reproductive organs would start right back up and kick back up. Because remember, I don't have any kids and I still want kids. So I just didn't want any future problems. So we decided that surgery was the best for me. And then, with any surgery like that's major like that, you have pre-operation things that you need to do, and you have post-operation things that you need to do. My surgery involved a hospital stay. I was there for about a day and a half, little less than 48 hours. Maybe about 36 hours I was there. And I don't know, I don't know how long the surgery took. I forgot to ask. But when I woke up from surgery, I had a catheter on, and I didn't realize. I was basically warned that, depending on how severe my endometriosis was, that I may have to wear a catheter while my bladder healed. But it was explained to me that that was the worst case scenario, so I was basically told not to even worry about it. So like I said, when I woke up, I didn't know that I had a catheter. I didn't even realize that I wasn't using the bathroom. I went into surgery that morning. I was done by noon, and it wasn't until the middle of the night that I realized that I heard the doctor draining something on the side of my bed, and I said, "What's that?" He said, "Your catheter." And then I was like, "A catheter?" And he's like, "Yeah." And I was like, "Can you show it to me?" And you guys, I swear to God, he held up this bag. He held up this. So when he held this up, my urine, I kid you not, was like cranberry juice looking. I went into shock. because this bag was holding my urine, and my urine looked like cranberry juice because I had had surgery on my bladder, and he had to cut into my bladder and actually remove some of my bladder. He told me that he moved about a quarter size, like the size of a quarter. Like, that's how much of bladder that I lost during the surgery, because the endometriosis had formed a nodule, which is like a hump, and it had to be like pulled or I believe that they burn it off. They had to burn it off, and it was just, it would not come off my bladder, so they just actually had to remove that. So I had documented this whole thing, and I had pictures. I had pictures of my scars, of my recovery, of me wearing the catheter, of the hospital stay. But when I moved, someone stole my phone at the post office. So I believe I only have about, 1 to 2 pictures to show you guys. But anyways, yeah, you guys, I wore a catheter, and whenever I went out, I had to wear this leg catheter, and it kind of just like straps to your leg. So, this was a big deal. I have really been through a lot, you guys. It did at some points take a toll on me. I'm still under treatment right now, and I had the surgery about 5 months ago. So remember how I said that the medication that I declined was Lupron? Well, I had stage 4 endometriosis, and it was so severe that my doctor still put me on Lupron. And you remember, you guys need to understand this, that, treatment is optional, but, if you want to be healthy, then it's best that you do what the doctors say. And even though I did not want to go on Lupron for 6 months, he recommended that it would be best for the future, if I still wanted children, if I wanted to remain healthy, that I do 6 months of Lupron. I think I have a picture, so I'll inject it right here, that needle. So with Lupron, you get an injection in your butt every 4 weeks. The injection is pretty painful. And where they inject you at is sore for about 3 days. And I'm not talking about that sore when you get like a tetanus shot or something. I'm talking about your whole butt cheek sore, can't sit down sore. Oh, and you guys, the side effects, I don't even have enough time to explain all that. Just know that the side effects, I'll just mention a few. Hot flashes, hair loss. I lost big piles of hair. Joint aches, like my bones and my joints, like I was just hurting, like I would stand up and be in pain. And it was one more that really bothered me, acne. Oh, actually another one, weight gain. So we have hot flashes, hair loss, weight gain, your bones and joints hurt. It was just, you guys, it was so much. Like, I can only thank God right now, just to even be sitting here right now able to tell you guys about my experience. And by the way, endometriosis is a very expensive disease. Right now I have one of the best surgeons like in the Western Hemisphere. So that's only because I have health insurance. So I don't even know what to tell anyone who's struggling like with this type of disease that is so expensive and so hard to diagnose, like what to do if you don't have medical insurance. Like, I don't know, like we need to do better like with this disease. And that's just one of the reasons why I'm making this video, because a lot of people don't know about endometriosis. I consider myself educated, and I heard about endometriosis, but I did not know what it was. I didn't know the symptoms of it, so I didn't know that I had it. And by the way, my doctor said that I probably had this since I was a teenager. And it makes sense because I went through so much with went out in my younger days, like with my reproductive organs, it was always something wrong. I always had a bladder infection, or like a bacterial infection, or like yeast, or it was just always a problem. And that should have been like one of the first signs that something was wrong with me. I don't know how this is all going to you know, to play out. I don't even know how this is going to sound, you know, coming from me. And you know, I haven't seen you guys in a long time. I don't know how you guys will take it. I don't even know if, I just feel like I'm babbling and I'm not making any sense, but it's because like this just hit me in the face, like bam, you know, you're sick and you need surgery, you need medical treatment, you always have to be on some kind of hormones to stop the progression of this disease. And I just, you know, I just really like I don't know. I mean, the good thing is that I feel better now. I'm not, you know, in pain anymore. I'm not down sick. I'm leading a normal, typical life. I go to work every day. I do have another minor surgery coming up. My surgeon is going to send a camera in to take a look at my pelvic area. My doctor recommended for me that as soon as I'm done with my treatment, which will be in the next about 3 more weeks, and then I'm gonna have that minor surgery, he wants me to start getting pregnant. He wants me to like have a baby now, and there's like an urgency in it. And you know, I'm not married. You know, my boyfriend and we've been together for 2 years now, and you know, I did move in, but you know, like I said, I'm not married. But there has been like a rush put on me to have a baby, and even try to get pregnant before it's way too late. So you know, me and my boyfriend have talked about it, but you know, honestly, like I don't know what's gonna happen with that situation. He doesn't like the pressure that the doctor is putting on him. I really don't like the pressure either. It's kind of like, you know, you need to do this or you might suffer now. And, you know, it's just not a good, you know, it's not a good way to go about bringing a child into this world. And I'll leave that at that. I'm just going to tell you guys this. Please leave any questions that you have below, and I'll make another video answering some of the questions, because keep in mind that I left out a lot of major details, a lot. I just wanted to show my face and let you guys know that I'm okay, and that I have been dealing with something that has pretty much taken over my life. But you know, it's all good. We all have obstacles thrown in our way. We need to get the word out there about endometriosis, because this could have been prevented. You know, I had stage 4, which is the last stage, to where you do start losing like parts of organs. Like, you know, part of my bladder was taken away from me. I have a very tiny bladder now. I cannot hold a lot of urine. There's been other cases in which people where it was on their bowels, and they had to have like some of their bowels removed, and they had to wear colostomy bag and all that. And you know, there's women who can't get pregnant, and it, you know, the list goes on and on and on. So we just really need to bring awareness to this disease, because the fact of the matter is, like, most women do not know they have it. And that was me. That was my case. I had no idea until it was essentially too late, until I really started to feel the pain of this disease. So anyhow, it's been nice talking to you guys again. Just leave some questions below, and I will make another video regarding endometriosis, and I will update you guys about the minor surgery that I am having in about 3 weeks. And that's when he's going to send the camera and look at my whole entire pelvic area, and hopefully, you know, everything is all good. Matter of fact, everything will be all good. Speak it into existence. So anyways, I will talk to you guys later. Bye.